Swayam Prabha. Digital India. Educated India.
Welcome viewers, welcome to this NPTEL course on Education for Sustainable Development. So, today we will start a new topic that is what is the role of ESD for sustainable healthcare services. So, let us begin with some of the common themes of sustainable development and healthcare. Healthcare, sustainable well-being and sustainable health and well-being, it comes actually under the SDG 3. That is the sustainable health and well-being. So, these are some of the pictures that we can see. So, here we have already discussed about what are the we have discussed about triple bottom line dimensions of paradigm of sustainability. Here we can see there are five paradigms. Here first thing is people, then prosperity, then here added the peace is another domain, and partnership and planet. Here is a, we can say it is a five pillar sustainable development paradigm. So, here we can see then quality of life, how quality of life depends on environment, economy as well as the human health and well-being. So, these are some of the clips for related to health, sustainable health, and sustainability, as all of us we know, is about the taking care of our society, environment, society, that is human resource as well as the economy. So, this is the basic parameters, but then we can also add like other parameters, other things like peace and prosperity and partnership, etc., depending on our objective, depending on our goal. So, here again the sustainable quality development, how it is a cyclic process starting from the knowledge development to to the employment thinking, etc., then again using the knowledge in the individual practice, then again being reflective, and again and reflect on this and the change, bring the change. So, this is a cycle, learning cycle. Similarly, sustainable quality improvement can be done in this cyclic way, and this is the sustainable promoting the health, promotion of sustainable development. It is also related to other SDGs. So, all the SDGs are interrelated, all the SDGs are interrelated because it is related to human being, it is because it is related to our planet earth, it is related to our economic system, it is related to our even animal planet. So, now we will focus on the dimensions. So, sustainable good health and well-being, sustainable that it comes under the SDG 3, that is good health and well-being. So, here again we will discuss about how knowledge education can play an important role. So, it also requires the contemporary world, it expects a set of knowledge, skills, values and attitudes in case of the learners to thrive in an increasingly diverse and rapidly changing society. As we know, all of us with globalizations, although everything is moving very fast, is changing very fast. So, how to adopt ourselves in this environment, in the fast changing environment with right kind of knowledge, skills, values, attitudes, etc., being the global citizen, so that it can so that we can provide we can provide some access, some opportunities, some sources of service, something like with the meaningful service, purpose, etc., towards the individual as well as the collective well-being. So, all these set of knowledge, skills, values, attitudes, etc., we have to transform it into the service, in the service orientation, into our adaptability skill, in our resilience, etc., that is to with intention to serve the community, so that we can achieve this individual and collective well-being, that is the UNESCO's declaration by 2021. So, therefore, UNESCO has been promoting this transformative power of education. ESD education should be transformative in nature, that it can bring 300-degree transformation in any domain it works, in any domain it applies. So, UNESCO has been promoting the transformative power of education to make the world a better place to live, and for the social transformation, for the individual and the societal transformation. So, the transformation means across the globe, across the planet, in all aspects of human life. So, how this transformation can happen, can take place. So, ESD has that power. So, ESD has that power, and ESD should be offered, ESD should be imparted, ESD should be provided in such a way that it can bring the total transformation and transformation in people's life, in the society, and in the economic domain also. So, therefore, this includes transversal competencies. Again, this requires this, therefore, education requires the transversal competencies. What are these transversal competencies? All these higher order thinking skills like the critical thinking, the creative thinking. We have already discussed about empathy, being empathetic, collaborative problem solving, system thinking, then collaborative problem solving, then attitude of cooperation, collaboration. So, being techno savvy. So, being empathetic, empathetic is means that it is different from being sympathetic. Empathetic in the sense that you can feel the same thing the other people are feeling in their problem situation, in their normal situation, or in their happy situation. So, that means you can also feel in the same way as the people, other people they are feeling, they are going through, they are experiencing the whole situation. So, this transversal competency, that means competency which can bring transformation in our thought, in our behavior, in our life, in our knowledge set and attitudes. So, critical thinking, all of us we know that critically whatever it has been given to us, we need to reflect on this and critically evaluate it, its feasibility, its usability, its utility, its cost effectiveness, its relevance for future, its everything we should critically evaluate it, then we accept it. And creative thinking, out of this critical analysis, then maybe that we can add something new, something more, that is with creativity and innovation, something new that we can add on. Being empathetic, so that we can feel, we can understand others' problems. Being collaborative in solving that problems. Being caring about the society, about the society, about the animals, about our environment, and systems thinking. That means we can develop this systems thinking in the sense way, in the larger way, with a planning and planning in a very effective way, with all kinds of logical thinking, logistics, and the implementation etc. So, systems thinking, that is not in a smaller unit, but in a larger unit, as how to bring the changes in the systems. Like when we talk about the health system, it is not just about one disease or one service or one patient, it is about the whole system, health system. So, in the larger perspective, how we are going to think innovatively, critically analyze it, think innovatively, then collaborate with others in solving the problems, and being empathetic to those. So, here all kinds of stakeholders are working together. It is not just about the client, it is not just about the clinician, it is not just about the direct stakeholders or investor, but it is all of us are either direct or indirect stakeholders of this system. So, therefore, education allows the learners to learn about and shape who they are and what they want to be, how they can relate to their heritage, how they can remain to other ways of being, and willing to learn throughout the life, and continuous learning, and again always kind of service orientation and attitude within us. Like for example, that means we definitely we have got some opportunities, and why not to learn something new, why not to acquire different skills and competencies, and as a result how, in which way we can contribute to our society, in which way we can help our people, in which way we can make our planet, our country, our planet a better place to live in, not only for present but for the future. So, that should be our motto, that should be our objective. So, now this is some of the clips of, like for example, how to ensure the lives and promote the well-being for all at all ages. These are some of the clips, the decade of the progress, like initially how it was emphasized on the reproductive health and maternal health, and then child health, how it is the progress, how the health domain, how the progress has taken place, and how the health workers they are working, then and then also a lack of data, wherever it is lack of data, and like investment in the universal health coverage is essential. A lack of data is there. So, countries with a death registration system, how the investment is required. Then here again the pandemic has halted or reversed the progress. So, in health domain, and shorten the expectancy also. Pandemic, how it has affected in a affected negatively in our society, almost the whole planet, whole world. So, how to that means how what are its impact, what are its results, and what we have learned out of this, how can we build up this resilient system so to face this kind of pandemic in future. So, all these things we will issue. So, therefore, SDGs provide us with a planned course of action to ensure the equality among people across the globe in all norms. The SDG 3 aims at providing the proper and adequate importance to all dimensions of health. Here again one more importance is that SDG 3 has clearly elaborated on the different targets, on the different, like what are its objectives. It has mentioned clearly in 1, 2, 3, 4, all the targets are there. Every SDG has its own targets. So, here in SDG 3 also UNESCO has clearly mentioned what are the objectives. So, it makes us easier to deal with every aspects of the health domain. So, again another thing is that not only to enhance the quality of our health services, but also equality. All the citizens should get equal access to that health services, that is also important. So, how we are going to use ESD to generate the awareness in our health system, so that equality and quality can be possible, can be achieved by everybody. So, here we can say UNESCO has already given a comprehensive plan of action. So, it aspires to ensure the health and well-being for all across the ages, okay, including a bold commitment to end the epidemics of AIDS, tuberculosis, malaria and other communicable diseases by 2030. It is equal access, quality health services, then ensure the health and well-being for all, equality, equal access to health services, and a commitment to end the epidemics like AIDS, tuberculosis, malaria, and recently also all these kinds of pandemics. We should be better prepared with to face these kind of pandemics. Therefore, it aims to achieve the universal health coverage. It is not just for one country, developing country or developed country, etc., but it is for the universal health coverage, that is by 2030, so that we can provide the access to safe and effective medicine, vaccines for all also. So, this is also, and to back this kind of these services, the creation of vaccines and effective medicine, etc., research and development for the vaccines is also an essential part. So, continuous research and development in the health domain also should go on, should move on to facilitate the efficacy and effectiveness. So, this is you can say again sustainable healthcare system. These are some of the clips, like for example, economy is important, economy, then thereafter the largest scale is the society, then the environment. So, that means how these three domains are very much important and form the health domain. So, this is again the cyclic way that you can go through, and here suppose it is the holistic approach. Again in other domain also we have already discussed about the holistic approach or whole institution approach. Here similarly in health domain also we can have an holistic approach, like here patient is the client, is the nucleus of the whole thing, but at the same thing service, hospital service, then the medicines, then the doctors, then the equipments, then the advisory board, then all kinds of outsourcing things, everything should be equally available, given importance for the holistic approach. Here we can say how much value we can add to our system. So, here the outcome divided by cost is equal to value. This is the basic formula. That means how can we rate, how can we measure the value of our health services if we are going to begin with any kind of entrepreneurship in the health domain. So, so human activity, that means both healthcare and economics, is the subsystem of the global ecosystem, and human health and survival depends on the presence of the intact ecosystem and biodiversity. So, we cannot ignore our ecosystem and biodiversity, because we are staying in, we have to adjust, we have to take into account the climatic change, climate, environment, biodiversity, what is there in and around us. So, we cannot ignore along with these systems, then only we can have, we have to build a robust and resilient health system. So, because there are so many other impacts also in because in ecosystem we are also exposed to different kinds of impacts like negative environmental impact like greenhouse emission, the waste generation, air pollution, water consolations, then pharmaceutical pollutions and industrial wastage, so many things we are exposed to. So, we have to take into account these environmental impacts, ecosystem impacts. So, that is why ecosystem takes a larger space in the health domain, because it contributes a larger domain. So, and again moreover society is there, economy is there, how to make a balance, and how can we build a sustainable health system. So, here WHO has already defined that sustainable healthcare as improves the maintains or restores the health while minimizing the negative impacts of the environment on the environment and leveraging the opportunities to restore and improve it, the benefit of health and well-being of the current and the future generations. So, here three things are there. Let us just WHO defines as a sustainable healthcare. First thing, it must improve and maintain the restore of health and well-being. At the same time, minimize its negative impact on the environment. Okay, that is all the waste management or the depletion of resources, all these things should be taken care of, and leveraging the opportunity to restore. Again, it has to create the opportunity to restore and improve it for the benefit and benefit health and well-being of not only the current generation, but the future generation. That is the UNESCO's definition of sustainable health. Okay. So, here sustainability, therefore, sustainability and resilience are the two common keywords we can say. So, sustainability should go along with resilience. It is not that independently sustainability can be purposeful, can be meaningful, or can be achievable. So, sustainability and resilience, we have to be tolerant, we have to be resilient to face all the challenges, to mitigate all the challenges, get the solutions, and the solution should be sustainable in the way that it can take care of our future things. Okay. So, therefore, the healthcare facilities, to make the progress in these areas, we need a very practical approach, very feasible approach, very cost effective approach. Yes, of course, cost effective does not mean that we are compromising our budget, compromising our economic aspects in the health sector, but we must be prepared to spend money. But it should be in a cost effective way, there should not be wastage. So, therefore, it has to be practical, again practical in the sense that we have to develop a blueprint, that who are the stakeholders, as earlier we have already discussed in which location we are going to set up, and what are the people, those who resides in and around that area, then who will be the stakeholders, who will be the investors, and what about the manpower. Then when you are recruiting the manpower like the staff, nurses, the doctors, then other consultants, etc., again we have to search for, because it is very specialized kind of domain. So, we have to really do a research, preliminary research, a survey, then only we can go for a health system. So, practical and physical approach that aligns with the budget consideration as well as the other facilities and resources available, and how to leverage the resources available in that area. Maybe that the manpower is available there, but they are not so much trained, and then we can train them through our training college to make them prepared for nursing staff, for supporting staff, for technical staff, etc. So, therefore, thinking strategically is very important. So, thinking strategically about the incorporating sustainability can help the hospitals to save the resources and become more efficient. So, here two things, like any organization, two things are important. One is the effectiveness and efficiency. How efficiently they can serve the purpose, they can deliver the services, and again how efficiently, and at the same time what is its overall impact on the society, how much benefit it incurs. So, that is the effectiveness and efficiency. So, so for any organization is important. Similarly, for the health system also, how to think strategically, design the schema, the blueprint, and manage the resources in such a way that so it can enhance its effectiveness and efficiency. So, these are some of the models of the 10 hallmarks required to achieve the health system sustainability scale. These are some of the things that you can find out in the internet also. These are some of the things, that is 10 parameters that we will be discussing also. So, here sustainability again simultaneously it requires a feedback system, monitoring system, an evaluating system, including the building infrastructure and organizational practices to implementing the measures line, everything for every system, for every organization evaluation system should be there, a feedback mechanism should be there, monitoring and evaluation, continuous monitoring and evaluation is very much required. Then only the again the healthcare facility also need to be very transparent, very reliable, very resilient engineering system to ensure safety for the patients, ensure safety for the doctors, nurses, and again working hours also, justified working hours, that means the doctors and nurses they should not be overburdened, they should not be overtired, they should not be overloaded with the work. So, proper distribution of working hours and resilient system. So, ensure safety of not only of the patients, but also for the supporting staff and the doctors. So, therefore, a genuinely healthcare system not only meet the immediate healthcare needs, but also promote the population health minimal with the minimal financial cost, in the sense that affordable cost. Some of the hospitals are coming up like with the where the poor people can also get the good services, better health services. So, therefore, there is a demand for this kind of hospitals. So, how everybody can get the services, equal kind of services, quality services with the minimum cost, like as depending on their affordability. So, also safeguarding the health for the future generation, like by conserving the natural resources, minimizing the ecological damage, and through research and development creating and innovating different kinds of vaccines, the medicines, because this pandemic has already taught us so many things. So, these are the things. So, this in this picture we can discuss about what causes the health and well-being. Yes, as we have already discussed, this is related to social sustainability, like healthy people, healthy and resilient people and communities. Environmental sustainability, like living with the planetary limits, biodiversity and environmental ecosystem. Then economic sustainability, there is a fair and sustainable economic system, that is good investment in the health domain with the good value and ethics and attitude to serve the people. Maybe that it can also happen with public private partnership also. It can also take place as a CSR unit from the companies and the MNCs. So, so here we can say the healthcare is again all is interrelated, is all connected, all the health domain to our environment, to our agriculture, to our healthcare, to our society, to our people, to the planet, to the plants, to the forest, everything is interconnected here. So, almost all the SDGs are interconnected, because it deals with people, deals with the society, deals with the planet. But even healthcare is also related to individuals, farmers, that means our agriculture, because the food we are taking, that also has an impact. So, environment we are living, the air quality, pollution, all kinds of things, that also measures, and the healthcare facilities available. So, all these domains are all interconnected. So, for all these reasons that we can say that how important is healthcare services, and how we can have a strategic approach to healthcare sustainability, and to incorporate the factors such as funding is the source of funding, is there rigorous facilities are there, tools, infrastructures are there, technology, there are low risk tolerance is there, support services there, everything, all these are all these are very essential component. So, why the sustainability is important for healthcare? Okay. So, the main question is that why the sustainability is very important for the healthcare, because sustainability strategies keep the harmful items out of the environment, because we have to be very vigilant from time to time in evaluating the effects of each and every medicine to the medicine to any all kinds of the taste and the labs and the all kinds of things. We have to be very vigilant about its harmful impact, that means positive impact, at the same time what are the side effects and how it affects the environment, or human life as well as the environment. So, similarly, by developing the programs now that ensures the waste is correctly collected, like for example, yes, hospitals, from the hospitals only the maximum almost around 40 to 50% waste is being created. How these waste are being managed, that is again That is again a very important issue. So, waste is correctly collected, segregated, treated and disposed, etc. Waste management is very, very important in healthcare. So, healthcare organizations can also be very confident about confident or ensure that this undesirable material should not pollute the environment, hospital environment, health or the patient care system, etc. So, where medical waste disposal prevents it, so that is the most important thing, the proper medical waste disposal prevents the fines and other financial repercussions also. So, so this is about, so when we talk about the medical hazards like the drug hazards and the drug wastage and side effects of the drugs and addressing the different waste system, these are some very crucial issues and so therefore, so because ultimately it affects the environment, it affects the human life, etc. So, reduce, the first thing is the hospital, that means management in the, that waste management, okay, and then reducing the organization's carbon footprint, because so much of energy is being invested there. So, the outcome of these things would minimize the organization's carbon footprint, making sure that the harmful substances do not get into the landfills, or it should not mix in the water system to manage the internal things. So, how this water purification and pollution control, and again operations to conserve the resources, again such as the employing the reusable containers, etc., engaging the robust recycling process, then mitigating the risk of the environmental contamination. These are very, very important issues in health sector. So, sustainable healthcare, again it has the three domains. One is improve the outcomes, reduce the overall cost and increase the value. These are the three basic objectives or values of the how to improve the outcomes. Like the starting point is to focus on improving the patient's outcomes. How that means health services, patient care system, and how the patients has come out of the hospital with a good health and well-being and satisfaction. So, they reduce the overall cost, like better quality of care is often less expensive over the long term. If the proper strategic planning is being done, then definitely this cost effectiveness can be balanced. Then increase value, better quality of care and equal or the lower cost leads to the higher value in the system, like affordability of the patients, affordability, that means it should be compatible to all not only all ages, but all people from all economic status, socio-economic status. So, the poor can also afford the better quality services, that is thing. So, that in that way then it adds to the value to the system. So, health outcomes divided by the cost of delivery, that is equal to value. Okay. So, that is equal to value, and these are the things that how this patient care is important, like how this healthcare is patient is the major factor, the nucleus of the whole system. Definitely his satisfaction, his health and well-being is most important. At the same time, it is also directly related to health related informations. Nowadays is all the technology, latest technology with technology, this e-health and e-health services, digital platform, digital technology, how information can be updated, can be quickly informed, that how the patient can be apprised about his own health status quickly through the digital platform. Medical technology, medicines are there, care management, that patient care system, care delivery, and overall along with the quantitative facilities or the infrastructure for everything, then the quality of service is important. And above all the human lives, because above all our patients, our clients are human lives. So, quality care service, quality health services means it includes all the empathetic aspects, all the emotional attachments, all the positive thinkings, happiness, all these things. It is not just you have just mechanically you are serving the people. Hence, in the healthcare most important thing is the human interactions, care and concern, and how to empathize with it, how to be patient, how to be tolerant, how to be caring towards the other, not only about towards the patients, but the patient caretakers of the patients or the guardians of the patients also. So, this is this much we will discuss right now, then we will continue in the next class. Now, just we have gathered the overview of the sustainable health system, then we go into the other details. Thank you very much.